I'm Dr. Kevin Green. I'm the Medical Director for Employee Health, and I'm getting my swine flu H1N1 vaccine today. Nationally, we're getting a lot of questions about the safety of the vaccine, for one. One of the biggest concerns is, will this vaccine cause Guillain-Barré syndrome, similar to what happened in the 1970s with swine flu vaccine? The answer is no. The vaccine is made in a different way. The current vaccine for swine flu is made the same way that the regular seasonal flu vaccine is made. So it has the same chances of complications as your regular seasonal flu vaccine would. The other two differences in the forms that are going to be available are the forms that are available every year for the seasonal flu vaccine, which is the injectable, which is a killed virus vaccine, and what's known as Flu Mist, which is the nasal spray that is a weakened form of the virus. It's weakened so that it won't grow in lung tissue, for example, because it's too warm. It can only grow in the cooler temperatures that you find in the nose. It's approved for children and adults ages 2 to 49. And in children, there's some evidence that it actually may provide a little bit better protection than the shot does. For adults, it's the same as getting a shot. The vaccine is safe for employees. We're encouraging everybody to get vaccinated, particularly with both seasonal and swine flu vaccine. There is some documented transmission of both swine flu and seasonal flu from healthcare worker to healthcare worker, from healthcare worker to patient, and from patient to healthcare worker. So that risk is going to be there. As the season progresses, there will be patients being admitted to the hospital that people will be caring for, and there's always the risk that they can catch the illness from a patient, or that if they get sick at home, they can always bring it into work. And so we're trying to encourage people to get vaccinated to help assure the safety of the medical and healthcare providers in case we do start seeing a large number of patients who need care. Right now is when the vaccine for swine flu is just becoming available. The seasonal flu vaccine has been available for a couple of weeks now. Most clinics have that. The swine flu vaccine has just become available. Health departments, employers will be making that available to employees. Like here at the medical center, over the next week or so, we'll be trying to go around and vaccinate people who would want the vaccine. I wouldn't wait for a shot. I would take this since it is available, mainly because although we haven't reached that epidemic level at this point, we are seeing an increasing number of cases above what we usually see in a typical year, and all of that we believe is swine flu. So it's beginning to circulate more widely in the community, so putting off getting the vaccine puts you at greater risk for getting the illness as more and more people become sick. The supplies may be limited in some areas. For example, although we have ordered some of the shots, what we may get is only the Flu Mist. So I'm encouraging everybody to go ahead and get it while it's available, and we know that they can get one. Our employee health nurse is going to give me a Flu Mist vaccination. So first off is a consent form where you give information about your other vaccinations. Have you ever had side effects to vaccinations? Are you allergic to eggs? That's an important one because this vaccine, both swine flu and seasonal flu, Flu Mist, and shots are made from eggs. And then some other questions related to underlying diseases to help decide which form of the vaccine might be good for you, because not everybody will be able to get the Flu Mist because of the age restrictions, and it's not recommended in people who are pregnant or have underlying immune system dysfunction too. After you fill it out, you sign it. With the injection, you just make an antibody called IgG, which is a class of antibody. With the Flu Mist, since it's being put on your mucosal surfaces, you also develop an IgA antibody related to that as well. So you have that dual antibody response that may provide some additional protection. Side effects are generally related to the injection itself, so soreness and tenderness at the injection site. With Flu Mist, you can have a little bit of respiratory symptoms, maybe a little fever or so for a day, maybe a little bit of a stuffy nose for a day. You will shed a little bit of virus, but in general it's not enough virus so that you'd have to worry about spreading the vaccine strain of flu just to anyone else. When you get the vaccine, it means you're protected against catching swine flu. So as patients come in, potentially have swine flu, you won't be able to catch it, or you are protected from catching it in the community, that if you're exposed to it in the community, you won't catch it and bring it into the hospital.